Hi, I'm Ruth FENNELL and I'm a technologist on the Dairy Beef programme. Today we are here to talk about the care and management of the newborn calf. As with any livestock system, the success of the finished animal is greatly determined by the management and care of the newborn, with special care and attention needed during the first hour of life. If the calf is slow to start after calving, resuscitation may be required. The farmer can suspend the calf upside down for a short period, pour cold water over its head and sit the calf upright on its chest. Very cold or weak calves should be dried off and put under an infrared lamp. The calf should be taken immediately from the cow. This reduces the likelihood of the calf picking up infection and also ensures that the calf is fed the right amount of colostrum at the right time. The calf's navel should also be dressed with iodine to minimise the risk of navel ill. The importance of getting colostrum into the calf as soon as possible after birth must not be underestimated. Colostrum is the first milk produced by the cow and contains important substances such as antibodies or immunoglobulins, growth factors and higher levels of vitamins and minerals than whole milk. Colostrum is important as calves are born without protective antibodies and therefore depend on the transfer of maternal antibodies from the colostrum in order to protect themselves. Calves should be fed at least 3 litres of colostrum in the first feed, or 8.5% of their birth body weight. Colostrum should be fed at body temperature in order to increase the absorption of antibodies. This first feed of colostrum should be within the first 2 hours of life. After this, the calf's ability to absorb the antibodies starts to decline. Colostrum must be collected immediately from the calved cow as quality decreases every hour after calving. An important point that is often forgotten is to feed high quality colostrum. Quality is measured by the amount of immunoglobulins present in the colostrum, which must be greater than 50 grams per litre. The most common on-farm methods for measuring quality are the Brix refractometer and the colostrometer. The refractometer is a more accurate way of measuring quality. It uses light to measure the density of the sample and should be at least 22% in good quality colostrum. All calves can be stomach tubed their first feed of colostrum. However, most commonly farmers only stomach tube weak or slow calves. Farmers should run hot water through the stomach tube to make it more pliable. It should be thoroughly cleaned and the tip should be smooth. Farmers must also ensure that the stomach tube is inserted correctly before allowing the liquid to flow. When collecting colostrum, hygiene is crucial. Contaminated colostrum can be a high risk of infection to calves and can also reduce the absorption of antibodies. Storing of colostrum is a useful practice and should be employed on all farms. Colostrum can be stored in a fridge at 4 degrees for 2 days, or in a freezer at -18 to -25 degrees for at least a year without affecting its quality. In order to maintain colostrum quality, frozen colostrum must be slowly thawed in a water bath of less than 50 degrees. A microwave should never be used. The management of the newborn calf has a huge influence on the calf's health and lifetime performance. Therefore, farmers should prioritise the care and management of the newborn and get colostrum into the calf at the right amount at the right time.